Hello, welcome back to my channel. Don't know what this is all about. Trying to be edgy. Hey guys, welcome to my channel. My name is Primrose and today I just wanted to talk to you a little bit more about narrowband UVB phototherapy. If you notice, by the way, I am wearing the same clothes, same makeup, same hair as some other videos. Don't freak out, I don't have a clone. Literally just got the recording bug, so I'm going with it. Like, if I can film and bash some out, and you know, I've got all these ideas for you guys and I'm just eagerly like trying to get all these videos out when I look half decent, I'm gonna go with it, okay? We're just gonna roll with it, so it's all good. So, on my last video, which will be my psoriasis skin story, you'll already know and be up to date with my skin. So, following this, I've been offered UVB Light Therapy. Now, what this is, now I am gonna go from the booklet they gave me. This is, I'm based in England, so this is the NHS booklet that the therapy is covered under. I'm not too sure worldwide what your eligibility will need to be. I'm going to go based on the book. I'm going to explain to you guys who might not have the resources or the facilities for a breakdown of this sort of stuff, just things that are in this booklet. My own interpretation, my own thoughts and ideas, so please do keep watching if you'd like to know more. So what is UVB phototherapy? So the official term for phototherapy is the treatment of medical conditions with light, in treatment of specific skin conditions, and it's that particular wavelength of light that is the most effective. So that is what they administer as part of phototherapy. They don't use obviously the wavelengths themselves, they use a reproduction of said wavelengths. And they do this using specially coated fluorescent tubes within a UV light cabinet. Now I know there's different forms of light treatment that you can undergo because I spoke to a nurse about this, but the one that they recommended me for is the UVB light therapy. So this is where it uses a narrow wavelength of UV light to use as treatment for the skin. And I didn't really know what I thought when I was offered this because one, obviously the waiting list for me would be 6 months plus, or I figured, but because I didn't have a job at the time, or don't have a job really, you know, I said that I was available anytime and they actually got back to me so fast. It was in like, within 2 weeks I'd say, they got back to me with an appointment and then they brought that appointment forward, so it's actually a month less waiting time basically for this appointment. And unfortunately I had a job interview on the same day, so I cancelled that appointment for the light therapy and went to the job interview instead. But not just that, because I also wanted to try the topical treatment methods for the skin that were given. I wanted to give those a chance first because they do highlight the fact that there's risk factors and all this stuff. I'm going to get into it basically, but I was apprehensive and I didn't know what to think, to be honest, so I'm just going to keep reading through and explain a bit more. The way that it works is the UV light reduces the inflammation of the skin, and this can help with various skin disorders. This can include psoriasis, eczema, cutaneous T-cell lymphoma, and then other conditions such as prickly heat. There's a vast range, okay? If it's to do with your skin, this could probably treat it. Now, when you go for a consultation for the UVB light therapy, they do highlight that it's not 100%. There is no cure for psoriasis, there's no cure for, you know, many other skin conditions, so you have to be aware that it might not work. And this is something that I prepared myself for because I wanted to go in with the thought that it's not going to work, because then I can't get my hopes up and I can't be disappointed if it makes it worse, which is also a possibility and they do highlight. Obviously these chances are very slim and they might not happen, but you need to be aware that it is a chance and it could happen. No matter how small, they have to tell you that it's a chance. I've spoke to some people who have said that it's worked fantastic for them. You know, they've got friends that have seen so much success with the light therapy. It's done them so many favours. You know, it's just worked brilliantly for them and they've had amazing results. And then I've had other cases where I've spoken to people who have had no results at all and it's been ineffective and done nothing throughout the whole treatment, so they've had to go through all of that effort just for nothing to change and nothing to happen, which must be heartbreaking, you know. And you've got to weigh up both sides, and you can't always look at other people. You've got to see what's right for you as an individual as well, because if you've got a job, it might not be practical for you to have to go to these treatments, which are twice a week, and they can probably range from a 5-minute appointment to half an hour. You know, it depends how extensive your treatment needs to be. And only you can find that out by talking to a medical professional if you are curious. But you have to be aware that these things aren't always a great success because there is no cure, unfortunately. And even within this booklet, it does say that the response may last only weeks, months, or sometimes years. So, you know, you could go the rest of your life without it. You could go 20 years without it coming back again. You could go a month, or you could go a week. You know, that is also something to consider, because it's not a quick fix. It's not, you know, you're going to be cured for the rest of your life, because it could come back, and it could come back so much worse. And, you know, if you've used all the amount of light therapy that you're allowed to have because of your skin, then what are you going to do? You're going to have to look at alternate treatment methods. And I'm not trying to talk anybody out of this, because, you know, it has worked amazingly for some people, but you just have to consider for you what is right for you as a person. Okay, so as mentioned, these treatments are twice a week, so you have to attend 2 times a week. I'm going to light therapy. I've recently started, and you can see my vlogs, which will be going up after this video, go live on my channel, so do keep an eye out for those. So my first days were the Tuesday and the Thursday, and now following this it's going to be the Monday and the Wednesday every single week, same time, same days. That might differ over Christmas because of obviously closures and things, but the nurse did assure me that, you know, I've got nothing to worry about, that they're going to fit me in when they can. If I still want to go ahead with 2 treatments a week, then they can change the days as needed. You know, it's not a problem. She said that they can do that, that's not an issue. And the average number of treatments you can have is between 15 and 30, and I think that's what they mean. You'll have that many treatments to see if there's a response or a success, basically. So this is all dependent on your skin's response to the treatment. And it does also say that the first few treatments will be quick and often less than a minute, but the duration for the treatments will increase per every visit. So I've just filmed my second light therapy treatment, which I had today, and I felt like that one was quite a bit longer than the first treatment that I received. I don't know if it actually was, I'm not too sure. I don't know if I was just super anxious the first time and it whizzed by because I closed my eyes and didn't want to see anything, or whether it was genuinely long, I'm not too sure, but I'm going to keep you guys updated with the vlogs anyway. So, okay, and then they have a list of things to bring with you. So they suggest bringing a dressing gown. As mentioned in my vlogs, you know, you will be expected to go into a dressing room, get changed into a dressing gown. With things like underwear, you can either take them or leave them on, take them off or leave them on. Obviously it depends for the person how bad the psoriasis is, where it is, you know, what areas you need the treatment on. Because mine's pretty much random patches everywhere and small patches, I thought, you know what, just do everywhere, you know. So I go in commando. It does suggest taking flip-flops as well, but I've never seen anybody wear flip-flops and never been asked to wear them, so I take them, but I've not had to use them, so it's completely like down to you. I take slippers, actually not flip-flops, but same thing. And then when you go, you're given some protective goggles for your eyes, and they just look like, I've never been on a sunbed, but if you go on a sunbed, I assume they'd give you them small like swimming goggles that go just over your eyeballs. That's literally what they give you, and they say that these are your pair, you hang on to these and you bring them to every session, so you can just slip them on. For me as well, I get a shield that goes over my face, just because I don't have psoriasis on my face or around my face, only on my ears. It just protects my face and my facial skin from the sun exposure, or from the light exposure, and it's just like, it's just a shield basically that goes over my face. It reminds me of what the police use when they go in and do like a raid or something, and it just goes straight over, you know, you're covered. So before the treatments, they do say that you can use your regular medications and moisturisers. It has to be done up to 2 hours before the treatment, just so it doesn't obviously coat the skin, affect the treatment anyway, to make sure that it doesn't block the light therapy receiving. Any creams or ointments that aren't moisturisers you're not allowed to use on the morning of your treatment as well. This includes any steroid medications that you might be on, so steroid sprays or gels. And then it also suggests avoiding perfume products as well, such as deodorants, aftershave, perfume, anything like that. Just avoid any product on the skin. And then post-treatment you can carry on with your normal routine, you can carry on with your normal products, and it was suggested to me that I also moisturise after, just to prevent any extra dryness happening onto the skin, which is what I do. So now getting on to the possible side effects. The not very nice part, the part that is probably unlikely to happen, but we've got to mention it anyway. Like, it's all good. We're going to run through these. So we'll start with the short-term side effects. So post-treatment you can experience redness or discomfort to a specific area, which might be similar to that of sunburn. The nurse did inform me that it will tan your skin, just because it is like the sunlight basically, and it can happen. So an effect like sunburn might happen after the treatment, but it shouldn't last more than 24 hours. You can have itchy or dry skin after the treatments as mentioned, so again it says just apply some moisturiser. Prickly heat and an itchy rash can occur, and the nurse did inform me that this is unlikely if you've never suffered from it before. If you've never had a case of it in your life, then you're probably not going to get it this time. She informed me that cold sores can happen just because of the overexposure to light, basically. So if you are concerned or you do get these, then you can apply sun cream to your lips, she says. Folliculitis can occur. So this is when you get inflammation of the hair root follicle. So when you apply your creams, so this is where you apply your creams, you don't rub it around in a circle like this. You apply it to the skin and then you move in the direction of the hair and the way that grows, and that will help to avoid folliculitis. Another side effect can be blisters. She says this is likely to occur when you've got, say, a certain body part covered up, and then for the next treatment you might have it uncovered, and say if you stand with your arms down one time, which you're not supposed to do, you're supposed to put your arms up onto like poles, and then you keep your arms up one time, then obviously the underarm area is at risk of developing blisters as well. And then it also says within the side effects that patients can experience worsening of their condition, and obviously if it does get worse you're just going to stop the treatment and you're just going to look at alternate forms of treatment basically. So that's just something to be aware of. And then obviously we have got the long-term risks as well. Obviously because it's exposure to sunlight, there is a risk of skin cancer, and nurses also do keep an eye on you. You know, they're going to be monitoring how you're getting on, they're going to be monitoring the response of your skin, they're going to be monitoring how much dosage you're having, how often you're having it, so it is going to be monitored, it is going to be recorded, and they're not going to let you exceed an unsafe amount of light therapy treatment or exposure to light. If you're having long-term UV therapy, increased premature aging might occur, increased freckling, wrinkling, all those types of things can be associated with the light therapy as well. So I have pretty much gone through everything that they recommend within the booklet that they do give you. Part of my own experiences, I was really umming and ahhing whether to go or not. I did my tarot cards, I tried to get some further guidance on whether I should go, and I don't know what was stopping me. Something was, and I don't know what it was. Now I don't know if that was just I was unsure and didn't know what to expect. I don't know what it was. There was just something in the back of my mind, and I think as well because I didn't expect it to work, that played a part, because I then expected that nothing would come of it, which was a good thing. The idea that I didn't get my hopes up, because that's something that I would have hated to have happened, and I would hate to happen now and think that I'm going to be cured, because I know that's not realistic. But then I also think that had a negative effect in making me think, well, what's the point? You know, I can just carry on with topical treatments, which is something that I still don't want to do because I'm on steroids. I'm on the highest level of steroid treatment that I can be on for my skin. So I don't know, something was stopping me, but now I've gone and now I've seen that and seen how it is, and that it's not so scary, and that there might be hope, and that there might be a chance. You know, I'm more than happy and more than open to going and seeing if it does make a difference, because everybody is different, everybody is individual, and just because it might work for me or work for Bob or whoever, just because it works for them, it might not work for you, or because it doesn't work for Bob doesn't mean it won't work for me. We are all individual, we all have different skin and needs and requirements, and there is nothing, if you can do something like this and you are miserable with the way your skin is and the way it makes you feel, honestly, if you have the opportunity to do this, then do it, because you will never know else. You will never, you'll never know what it could be like. The nurse even said to me on my first treatment that they use light therapy in children. You know, that the booth that they have is safe for children to use, and they do use it on children. Now, if it was that much of a risk and if it was that much of a negative thing, children wouldn't be using it. They wouldn't be allowed, and their parents wouldn't consent to letting them do it as well. So this is my thoughts on light therapy. I was apprehensive, and I understand that a lot of people out there will be as well, or people out there will be lost in terms of where to go next, because I didn't know anything about light therapy really until I approached a specialist. I had to pay to see a specialist for my skin, else it would have been 6 months to even see somebody on the NHS. So I paid to see him and see what he suggested. He suggested obviously the treatments I'm doing. He said that I could do at-home light therapy, which it's not the same light that they can give, but it's a different form of light which can help, and I felt like I couldn't afford to do something like that. And the machines are over £200, they're very expensive, but they are a good starting point, he did say, for people that can afford that. And if it doesn't work, then you are within every right to take it back and get your money back. So obviously if that's an option for you, then definitely have a look into those. I think they're the Philips machines. I'll have a little Google and I'll post it down in the description thing, so you can go and have a look. But that wasn't a viable option for me. Obviously from that, he said, we're going to try and get you light therapy then within the NHS. They'll follow it up. So they did, and it's led me to this point. And because it's been an option, there might be hope that I can get better and that it can go, or the majority of it can go. And yeah, if it is an option, definitely look into it more. Definitely speak to a medical professional, doctor, GP, whoever can help you. I'm going to obviously keep you updated with all the vlogs that I'm going to be doing. I'm going to be doing vlogs post every session that I have, just keeping you up to date and letting you know how I'm finding it and how it's going and how it's working for me. And I really hope it's going to help you make a decision by giving you some more information and giving you all the information that I was given. And yeah, I don't have anything more to say. I have rambled enough. I feel like this was a very serious video. Let's just shake it out a little bit. Oh, I need to stretch. Oh, I feel like this was very serious, very talky. I hope you guys had a cuppa, because you're gonna need it. Okay, shake it off. Serious is gone. So yeah, I really hope you did enjoy this video and it has helped somebody out there. I feel like I've been pretty alone with my skin and how it has been for a long time, so if I can stop someone feeling like that or help somebody else, that is what I set out to do. If you did enjoy, please do give my video a lovely thumbs up. I would very much appreciate that. If you want to see my light therapy vlogs, do give me a follow. I've also got makeup videos, so many other vlogs, videos, witchy things coming up as well. It's not all just skin stuff, so definitely please do keep an eye out, give me a subscribe, give me a like, and hit that little bell button so you do get notified every time I upload as well. Any questions that you do have, do post them down in the comments. I will try and answer them as best as I can. Do bear in mind I'm not a medical professional, so this is all just my opinions, but any questions, comments, anything that you think I can improve on, please do leave it down below. I'll be more than happy to hear from anybody at all. Thank you so much for watching. I really hope you enjoyed this vlog, talk, skin thing, whatever this is. Whatever this is between us right now. It's been really nice to just get it all out as well. So yeah, if you stuck around, I appreciate you. Thank you so much for watching, guys. I will see you in the next one. Bye!